recent articles in Lancet that show that if you can get 50% of your population into early education, the economic possibilities of these children who go through early education increases by a factor of 17. If parents understand that and understand that this allows their children to have a future, they're going to participate. So it's a question of just getting the knowledge down there and getting the ability of the local management teams to convey the knowledge and to show them what works within their traditions and within their culture. That's what allows us to help you make progress, both with your refugees and the pastoralists and the local society.
Speaking of the refugees, how many percent of the refugees in Dolado, for example, Somali refugees, are women and children?
85% are women.
Talking about the health of women, you're an expert in that. Can you give me an idea of what it looks like?
Well, at this point, I don't think there are a lot of interventions for their health aside from nutrition. Eventually, what I would like to see is family planning there. I would like to see these women getting iron, micronutrients. I'd like to see obstetrical services because some of these women are pregnant and are going to deliver. And if they have an emergency, I want to have the ability to get them to some safe facility so they can have a cesarean section. I want to see programs for newborns and newborn survival. That isn't there quite yet. So if we're going to consider that some of these camps are going to be quite permanent, then we have to establish the health facilities that are being established in the rest of Ethiopia there for the refugees. I mean, that's simply what has to be done. This is a huge crisis. One of the reasons I'm here, let me tell you just something personal. My family, many of them were decimated in the Holocaust. And I felt that when, in my generation and in my life, I never wanted to see something like that happen again. So when this occurred and I was given the opportunity to come out and see what was being done, I wanted to participate and I want to bring back the knowledge to other people in Los Angeles and in the United States so there will be recognition and caring.
Yeah, I'd like to, it's interesting that longer term, I agree with everything Dr. Judy said, but when I'm asked what is an intervention you would suggest to improve the health and nutrition of both females and their children, and I would say investing in the education of girls. We know clearly, unambiguously, that girls who are better educated tend to marry later, tend to have their first child later, and all of that, and also tend to be seen as having more empowerment. They have the confidence of taking care of their children and themselves. So that's a longer term. I mean, obviously, when you have acute malnutrition, you have to deal with it immediately. But from the point of view of Ethiopia as a society wanting to improve the country, one of the most cost-effective interventions we have is investing in education of females.
And have you seen that going on here? Have you?
I actually haven't. We've been traveling around and clearly Save the Children, for example, one of the reasons they are investing in feeding programs for school-age children is not simply the nutrition part, that's important, but also it encourages higher and continued attendance of girls in schools, which is a very powerful intervention.
Mm-hmm. Since girls are really the family members who have to bring the water home, what Save the Children does when it creates schools is to have wells right by the school so the girls can get the water, go to school, come back home. They also have separate latrines for the girls so they feel that there's a greater sense of security. The parents are more likely to send the girls to school. And if you look at the schools that we're developing with the help of, obviously through the Ethiopian government, you're going to see a pretty much 50-50% girl-boy ratio.
We have talked about the challenges. When you live here, are you going to leave here uplifted morally or intellectually or a little bit down?
I'm going to leave here exhausted, number one. I'm really at the jet lag. There's a 10-hour time difference. But I think I'll leave here. This is my third visit, and I always leave here feeling better. And each visit, I actually feel more uplifted because I see that there is work in progress. I see the programs that have been established. I see the work of the government. And I leave with hope. I don't leave with despair.
I also am leaving very hopeful. Your opening question, there's been an underinvestment in nutrition, and a part of that has related to, in some ways, nutrition's an orphan. A little bit a part of agriculture, a little bit a part of health. And the ENGINE project really, for the first time, marries agriculture to health in a way that's going to be very positive to improving nutritional status of children. At the launch on Tuesday of ENGINE, I was really taken by the remarks of your Minister of Health, Dr. Kasete Adamu, who talked about the essentiality of this kind of approach and the genuine commitment of the government of Ethiopia. And then when you talk to people who will benefit from these interventions, they're so enthusiastic. So that energy, both at the government and community level, is palpable, and I'm going away hopeful.
Well, Dr. Judith Reichman, Dr. Eileen Kennedy, thank you very much for your time. It was a pleasure.
Our pleasure.
Thank you.
Thank you so much.
Okay, thank you very much.